Okay. So good afternoon, everyone. Welcome to voting list number 17. It is Thursday, March 27. This is still the Health and Government Operations Committee. And just for those of you that are watching at home, the bills you're about to see, we have already held hearings and have discussed these bills in subcommittee at length with all the parties involved, whether you were for it or against it. Here in the House, and most of these are basically the cross-file of very similar bills to what we passed. So if you see us go fast, it doesn't mean that we don't care or do not know them. Trust me, we have dissected them quite well. So we're going to start today with House Bill 384, and that is Maryland Disability Service Animal Program established. This is favorable with amendment, and it is Aaron and Bagnall.
There is an amendment for this bill that's also an amendment to Senate Bill 157. The bill establishes the Maryland Disability Service Animal Program in the Maryland Department of Disabilities to refer eligible individuals to selected nonprofit training entities to be paired with an appropriate service animal. The amendments require an eligible individual to be a resident of the state. They strike the requirement that the program refer eligible individuals to the treated entities. They strike the requirement that MDOD manage and supervise the program or promote the program through outreach methods. Sorry, I ran here.
Take your time. Take your time.
I'm like, they're voting. Requires the governor to include in the annual budget bill an appropriation of $25,000 to the fund. It provides that the act is contingent on the Department of Disabilities certifying that the department has sufficient staff to administer the program by October 1st, 2026, and notifying DLS of the certification. If they don't notify DLS that they have sufficient staff to administer the program by October 1st, 2026, the act does not take effect. And these amendments are to Senate Bill 157 and also to House Bill 384. So and they were in public health this morning.
So it will conform the bills in the same posture after the amendments. Okay. Delegate Bagnall, anything you want to add?
Just that these amendments also address the fiscal note, which was the outstanding question on House Bill 384. And with that, I would move the amendments.
The amendments have been moved in second to House Bill 384. Are there any questions or discussion? Seeing none, all those in favor?
Madam Chair, I'm sorry, I have a question. In the amendment regarding the notification of the sufficient or insufficient staff, there's a required notification, correct? One way or the other, it's required? Because I sort of heard that if they didn't hear anything, they would assume they didn't have sufficient staffing?
She said yes.
So if they don't hear by October 1st, 2026, it does not go into effect. If they do hear, it goes into effect the date that they hear. The date that DLS is informed.
So I guess I'm wondering if there could be, and please, Madam Chair, if there's no notice, no requirement of notice one way or the other.
Sorry, I got it wrong, actually. In C2, it says if DLS receives notice that DOD lacks sufficient staff to administer the program on or before October 1st, 2026, then the act is null and void.
So there is a required notice.
So when they get notice that they have it, that's when the act goes into effect. But if they get notice that they don't have it, then it's null and void.
I'm just interested in the notice being required.
It is required either way.
Required.
That's, okay, thank you.
Sorry.
I'm good, thank you.
And I think that was compromise language there also. The senator spoke to, because he offered that sunset to make sure that.
Thank you, Madam Chair. Sorry.
You're welcome. It's okay. It's all right. This is the place. Any other questions or discussion on the amendments so that we're clear?
Move the amendments.
Second.
Amendments have been moved in second. All those in favor say aye.
Aye.
Any opposition on the amendments? Oh, question?
On the amendments.
Okay, 1 second. Let's do the amendment again. All those in favor say aye. Aye. Any opposition on the amendments? Seeing none, on the bill as amended. It's been moved in second. Discussion or concerns? Delegate Shalega.
Thank you.
You're welcome.
While I think disability service animals are wonderful, I think we have a $3 billion budget, and we should not be putting new programs in. So I will be voting no. Thank you.
Yeah. The fiscal, I understand what you're saying. The fiscal note is $25,000 for this bill, for a bill that would, a program that would help the disability community. But I understand what you're saying.
It's $25,000, but again, we have a $3 billion budget. And if there were a time to pause and come back next year and do things like this, it would be now. So I'm voting against this and many other things.
Yeah.
I just think
understand.
we have to say no. Thank you.
I understand, thank you. Any other questions or concerns? And for the record, Delegate Senator Samanier will not be able to come. Will he be able to come next year? Isn't he retiring? The year after that? But he's retiring, right?
He's just out running again.
Okay. So who's going to take his place? No, just let's be quiet. Okay, we won't go there. I'll be good. I'll be good. I'll be good. Okay, any other questions or concerns? All those in favor say aye. Aye. Any opposition? All right.
So,
Okay, opposition. Let me go through the opposition.
I like what you just said.
Delegate Shalega, Delegate Morgan, and that's it. Okay. We will have friends. Okay, any co-sponsors on the House bill? If you don't want to be a co-sponsor of the House bill, raise your hand. Delegate Shalega and Delegate Chisholm and Delegate Morgan. Okay. All right, let's move on. Actually, Senate Bill 48, I have to take that one too. Yeah. Department of General Services, identification cards. This is veteran status notation. This is favorable. It is Lindsay and Kurt.
So this bill was not cross-filed. It authorizes the Department of General Services to include a notation on an identification card indicating the holder is a veteran if the individual presents specified documentation to DGS. DGS may limit the notation to specific categories of identification card holders. If they provide that option, then DGS must include on the application an option for the applicant to indicate that the applicant is a veteran and consent to being contacted by appropriate executive branch agencies regarding the individual's eligibility for state or federal veterans benefits, subject to provisions in the Public Information Act, and on request by an executive branch agency, DGS must transmit to the agency appropriate information about each identification card holder who's given consent, and DGS may adopt regulations to carry out the bill. There are no amendments. This had a unanimous vote in the Senate.
Okay. Is there a motion on the bill? It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Excuse me? Okay, let's go to Senate Bill 57, Funeral Establishment, Crematories, and Reduction Facility, Disposition of Unclaimed Remains Veterans. I tell you, Senator Samanier is an HGO, member here. Alumni or something. It is favorable. It is Lindsay. Go ahead.
This also was not cross-filed. The bill establishes requirements in the business regulation article that conform to those that are already in place for the health occupations article, requiring a licensed funeral establishment, crematory operator, or reduction facility to take specified actions if a veteran service organization does not take possession of unclaimed cremains, hydrolyzed remains, or a portion of unclaimed soil remains that qualify for a lot in a state veteran cemetery. The bill also makes conforming changes to the health occupations article with regard to unclaimed hydrolyzed remains of veterans. The Senate vote was 47-0.
All right. Is there a motion? Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Senate Bill 60, Maryland Medical Assistance Program and health insurance require coverage for calcium score testing. I believe, was that Delegate Wood's bill that we passed? Yes. Okay, so it is favorable. It is Lisa.
This is identical to its promise.
Okay, bill has been moved, and is there a second? And second. Any questions or concerns? All right, seeing none, all those in favor say aye. Aye. Any opposition? Seeing none? Oh. Oh, there is? Okay, thank you. Let me slow myself down. Delegate Shalega.
And I support this, but we have a deficit.
Okay. Delegate Chisholm, Delegate Morgan, Delegate Riley. All right, let's move on to Senate Bill 67, Health Occupations Board, notation of veteran status and eligibility for benefit. Favorable, Lindsay.
This bill was not cross-filed. It authorizes each Health Occupations Board to establish a process to include a notation of an individual's veteran status on a license certificate, registration, or public profile. The bill establishes additional specifications for any process that's implemented by a board. The Senate vote was 46-0.
Bill has been moved in second. Any questions or concerns on this bill? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Senate Bill 94, Maryland Medical Assistance Program, maternal health self-measure blood pressure monitoring. It was favorable. Aaron.
It is identical to its cross.
Bill has been moved in second. Any questions or concerns? Delegate Shalega.
Thank you. If I recall, they're already doing this. If this is not a new increase in the Medicaid program, they're already doing this. Is that correct?
That's correct.
Okay. Then I can vote for it.
That's correct. That's correct. All right. Any other questions? All right. All those in favor say aye. Aye. Any opposition? All right. The bill passes. Unanimous. Okay. Senator Samanier again. Senate Bill 157, Maryland Disability Service Animal Program established. That is the cross of House Bill 384 that we just voted. It is favorable with amendment. It is Aaron.
So it would have the same amendments that were added to.
Bill has been moved in second. Any questions or concerns on the amendments? All right, seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, and the bill as amended. Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Shalega and Delegate Morgan. All right. Not that that's all right, but I'm just moving us along, sorry. Senate Bill 163, Health General Article references to mental health. It was favorable, and it is Aaron.
This bill was not cross-filed. It replaces remaining references to mental hygiene with mental health in the Health General article. It requires MDH by July 1st, 2027 to review departmental regulations and replace any references to mental hygiene with mental health. And it also requires MDH as soon as practicable to update all public-facing electronic materials accordingly.
Bill has been
In public health.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to Senate Bill 172. Oh,
Sorry.
what was it?
Was that?
That was Senate
163?
Bill 163.
Yes, I had a question. I'm
Yes.
sorry. So I was looking at it again, and I don't remember at the bill hearing if the sponsor had mentioned it. I'm sorry. So currently in our code, we have both definitions, mental hygiene and mental health currently, and we're changing.
So Aaron is going to address your question.
Okay.
Aaron.
So MDH used to be Department of Health and Mental Hygiene.
Okay.
So these references, after they changed their name to MDH, not all of the former references to mental hygiene have been updated in the code. So this would just go through and update those outdated references to mental hygiene.
Okay, so currently, under both of those definitions, they're doing the same. We just want to change the actual verbiage and the language
Yes.
in the code. Okay,
Of what
thank-
it is today.
What it is today.
Just
Thank
more
you.
modernized terminology.
Appreciate it. Thank
Delegate
you.
Hutchinson.
Yeah, I've actually always had a question about this when we do changing. Did I hear you say it's only when we do it electronically, or all of the smart books get updated too?
That would get updated too. So actually in the bill, you can see that just like any other amendment change is in the bill. So that when there's in the code, when there's references to hygiene, this bill would change those to mental health. And then what this bill also requires is for MDH to go through their COMAR and also public-facing, so things like their website would also have to update the terminology.
So they reprint all of the books, or
Yeah, they get reprinted all the time.
But they get reprinted, not because of the change. They get reprinted, the supplements every year. No, regardless of what we do. So it's not like because we make a change, we're gonna spend money now on reprinting the book. It's when it's next reprinted.
Got it, thank you.
You're welcome.
It's a
The
supplement every year.
Give you a slip of paper to put in.
Yeah, the end of it.
Oh, sorry, I didn't.
And those little books gave some of us nightmare in law school. Just saying, just saying. Anyway, we did take a vote, but just for the record, all those in favor say aye. Aye. Any opposition? Seeing none, let's move on to Senate Bill 172, Maryland Veterans Trust Board of Trustee membership. It was favorable, and it is Lindsay.
This one also was not cross-filed. It expands the membership of the Board of Trustees of the Maryland Veterans Trust to include the Secretary of Disabilities, ex officio, or the Secretary's designee. It had a 46-0 Senate vote.
Any questions on this bill? It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, let's move on to Senate Bill 182, Maryland Veteran Service Animal Program, eligibility, family members of veterans. It is favorable. It is Lindsay.
This was also not cross-filed. The bill expands eligibility for the Maryland Veterans Service Animal Program to include an eligible family member, meaning a spouse or dependent of an eligible veteran, and makes conforming changes. There are no amendments. The bill was 46-0 in the Senate.
Moved in second. Any questions or concerns on the bill? Delegate Shalega.
I don't think there's a fiscal note on this, is there? There's still the same program. There's just.
It's the eligibility, so it's the same amount of money that they've got.
Thank
You're
you.
correct. Thank you for the questions. Any other questions? All those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 213, Maternal and Child Health Population Health Improvement Fund use. It is favorable. It is Aaron.
It is identical to its cross-file.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none? All right, let's move on to Senate Bill 222. Okay. Public Health Cannabis Public Health Advisory Council membership. It is favorable. It is Aaron.
This bill is not identical to its cross-file, and it was discussed in Public Health Subcommittee this morning. The Senate bill, the way that it's identical to the cross-file is it adds to the Cannabis Public Health Advisory Council the administrator of the Motor Vehicle Administration. The Senate bill also adds the executive director of the Office of Social Equity in the Maryland Cannabis Administration to the council.
All right. Delegate Bagnall.
This was unanimous. We felt that it was a good addition to the bill, and I would move the bill.
It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. It's unanimous. Senate Bill 220.
I'm sorry. I have a question.
We can.
Sure.
Back to Senate Bill 213, I know we're going.
Hold on a minute. 222, we're finished, right? All those in favor say aye. Aye. Any opposition on 222? It passes. It's unanimous. 213.
About it. Is this the program that they took money out of?
Yes.
Okay. This is the overfunded program? Thank you.
We don't believe it's overfunded. Let's agree to disagree with a smile. As my prayers say, with a little grace, with a little smile this morning. Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Senate Bill 229, Health Service Cost Review Commission, favorable. Aaron.
It's identical to its cross-file.
Bill has been moved in second. Any questions or concerns? Seeing, yes, Delegate Shalega.
9.
Yes, we're going to address it right now. Aaron?
This is the repeal of the sunset on how the user fees are assessed on the hospitals. So it would continue to be assessed in the same manner.
Okay.
This is the budget for the HSCRC. In order
Passed
for
the
them
House
to
130 to
function.
7.
Yeah, 7 people voted against it. I'm just seeing if I was one of them.
Okay. Good checking. Okay, good, to be consistent.
I did not, but I may change my mind on the floor.
Okay, so was it moved in second? Okay, so all those in favor say aye. Any opposition? I'm holding my breath. Any opposition? Okay. We got it. All right, it's unanimous here. All right. So Senate Bill 371, State Board of Pharmacy renewal notices. It is favorable and it is Lisa.
It is identical to its cross-file.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none. Senate Bill 374, Counties Council Screening Professional Firefighters, James Jimmy Malone Act. Favorable. Lisa.
This is identical to its cross-file.
The bill has been moved and second. Any questions or concerns? All those in favor say aye. Any opposition? Seeing none. Great, may he rest in peace. Senate Bill 589, Opioid Restitution Fund Interactive Dashboard is favorable and it is Aaron.
It's identical to its cross-file.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Senate Bill 748, Public Health, Alzheimer's Disease and Related Dementias. It is favorable. It is Lisa.
It's identical.
Bill has been moved in second. Any questions or concerns? Yes, Delegate Shalega.
Sorry to be the squeaky
No,
wheel.
it's okay. It's all right.
Is this the third website for Alzheimer's that I voted against?
This is the website that you voted against.
I'm going to be a no then. Thank you. Just checking.
You have to be consistent, okay? All right, so the bill has been moved.
She's gonna be up on the dashboard.
Touche. All right, oh boy, hold on a second. It's been moved in second. All those in favor say aye.
Aye.
Any opposition? All right, opposition. Okay, Delegate Shalega, Delegate Chisholm, Delegate Morgan, and Delegate Kipke. Okay. All right, and I got it. We are almost done. Senate Bill 749, State Board of Dental Examiners, favorable with amendment. It is Lindsay.
So this bill is a cross-file of House Bill 723. The bill requires the State Board of Dental Examiners to issue a license to a dentist or dental hygienist licensed in another state within 15 days after receiving the applicant's completed application. It also has requirements for dental radiation technologists authorized to practice in another state. And if they meet the requirements for certification, then the board must issue the certificate within 15 days after receiving the completed application. On page 3 in your packet are amendments adopted in Health Occupation Subcommittee that require MDH to develop a plan for a temporary or permanent authorization to practice a health occupation in the state for individuals who are not licensed in the state, hold a license or other authorization in another state that is equivalent to the license or authorization in this state, and left employment with a federal agency after January 20th, 2025, and then requires MDH to submit the plan, including any statutory changes that are needed to Senate Finance and HGO by October 1st, 2025.
Rosenberg.
There were concerns expressed in the committee as to whether this was okay consistent with a single subject rule. Since the meeting this morning, we do have correspondence with the AG's office that it is consistent with single subject. So that is not a problem.
Okay. Is there,
Council for getting that so quickly.
okay, can we move the amendments? Okay, can someone move the amendments?
Second.
It's been moved in second. Questions or discussion? Delegate Kaiser.
Do you think we can invite back Senator Kramer to ask a brief question?
Delegate Morgan.
Sometimes we try this on the floor, and the excuse that we hear on the floor when we amend the Senate bill is that there's already another bill over in the opposite chamber, and they would just pass that bill. So we can't possibly amend this bill because the other one would just die by amending it. So aren't we just, what's the point of actually amending this bill instead of, I mean, the clean bill is already over in the Senate.
So this is a topic that came as a result of what's, happening at the federal level. We're not aware of it, and they are similar. So this is very different than having another bill, seriously, in all honesty.
Okay, thank you.
Okay? You're welcome. Any other questions or concerns?
I don't understand what you just said. Sorry.
No?
Something about the federal level and.
This amendment here, right, came about from what's happening at the federal level. It was an idea, Delegate Lopez, where you like to go ahead and address it. The Delegate Lopez came to me with, and I said, we can try to address it, but we want to make sure we do it properly, which is why we went ahead and checked to make sure we could do it, because it is related to health. So Delegate Lopez, why don't you go ahead and address it?
Sure, thank you, Madam Chair. So something I had heard from constituents was that there were a number of federal workers who had been impacted by the firings, who work in healthcare and have healthcare occupational licenses. But the way the federal government works is they honor any healthcare license from any state. So those folks who have recently been fired would not be able to be hired in Maryland right away because they don't have the right type of Maryland license. And so this is an amendment that asks the Department of Health to come up with a plan to be able to offer the opportunity to apply for licensure, or think through ways of reciprocity if there are avenues for that, even though we've passed legislation to that end already. So it's
Just for dental examiners?
no, it's across the board.
Oh, how can that not violate the single subject rule?
Because it's a health occupation license, so it doesn't. That's the reason. And look, and let me tell you why I thought that it was a good idea. Because for the federal government, for you, even when you work for the Department of Justice, and I know I used to work for the Department of Justice, you just need to be bar licensed in any state in the nation, right? Any of the 50 states. And it doesn't matter where, and you can work for the Department of Justice, as opposed to working in Maryland, where you have to have the license for Maryland. The federal government does not require it. So you have these people that are highly qualified, a lot of education, a lot of experience, that are now out there without a job. And Maryland has all these, we have a healthcare workforce shortage, and they have this license from another state. And basically what the amendment says is, can you, Department of Health, the health occupation boards, look into this group of people that are licensed somewhere? Can we utilize them in Maryland? Is there any way that we can cut the red tape, sort of similar to what we do to people that are in the service, right? That are in the Army, that are in the Navy, and their spouses move here, and we've done a lot to get rid of a lot of the red tape, because you have a population that is out there unemployed, and we have a need here. Can you look at it? It doesn't predispose the outcome on anything. It simply says, can you look and see what can be done for this group of people?
After 12 months.
I think Chisholm was first.
Yeah,
and I was
Chisholm.
second.
I understand, so is this has the ability to supersede all other compacts and reciprocity?
No, absolutely not.
It's just looking at it.
Yes, to look at it. Yes, that's it. Yes.
And then there would be, they must come up with a proposal, and for that proposal to take effect, we have to pass it. It's got to become a law.
Okay. All right.
Just to look at it. Delegate Chalega.
Thank you. Could I suggest you change the title? I mean, it's not a state board of dental examiners, blah, blah, blah. Oh, it's in the amendment.
Yes.
Look at that.
Bill.
What did we change the title to?
Health occupations, authorization to practice for former federal employees and dental applicants licensed or certified in another state.
Again, we thought of Chalega. I kid you not. You think we're kidding, but I kid you not. Well, that's the reason why. And we appreciate you, okay? Which, when I say that we welcome your thoughts, we really appreciate it because I just think that everyone, honestly, that everyone brings something to the table. We all bring experience. I don't care who you are. If it's going to add and help, then it's important, right? If it enhances the policy we're trying to pass. And you were absolutely right, but I know that will be something that matters to you, okay? Delegate Rosenberg.
I think we had a lively debate on the floor yesterday about whether businesses were being driven out of the state by state policy. And I think this bill, as amended, is an effort to keep people in the state who are skilled and who want to be here. And that's why I think the subcommittee gave it a favorable report as amended.
Delegate Morgan.
Thank you. So once this is implemented, it's just for the department to look at the
That's
issue.
right.
They have the power to implement something.
No.
No.
They have to come back to
here.
us.
That's
Yeah.
Bill. That's next year.
Vote against.
We want them to look at the interim.
Well, I was going to make the argument, I was trying to figure out if this made it easier to have employment in Maryland or harder.
I think that it will make it easier to have employment if they can come back with a solution, right? And if they have something in the interim that may help that we're not thinking of, maybe they'll write to the committee and let us know, right? So we're just trying to help a group of people that are unemployed, that we need in this state. All right, Delegate Olson.
I guess my question is, why wouldn't this already be covered by our reciprocity agreements under all of the healthcare articles, all of the different health occupations that we have reciprocity agreements?
Because we don't
and
have
compacts?
reciprocity with everyone. And I don't even know that we have reciprocity with, who do we have reciprocity with?
I mean, I can't speak to that, but this covers all of the health occupations. So you're right that you all passed a bill to allow any of the boards to pursue reciprocity with other states that also have reciprocity. So hypothetically, the boards could take action in the interim if there's no statutory change needed. So an example would be they could look at states to prioritize reciprocity agreements with to help target these former federal workers or something like that. So to the extent there's no statutory change needed, they could take action before next session. But if there's a statutory change needed for them to take action, then you all would have to come back and pass something next session.
And do we know in each instance whether there's going to be statutory changes that would be needed? Or is it possible that the boards could come up with this plan and implement something without having to make any statutory changes?
Well, we would have to see what the plan is before we know if there's statutory change needed.
That's why you need it. Yeah.
Okay.
It's not that clear. And that they're going to do it anyway, right? I mean, we put these bills every year up for the boards, right? So rather than assume, let's just direct them to look at it. Delegate Rosenberg.
Direct them is the right word. The bill says shall. This is not asking them. This is directing them.
Yeah. Yeah. Delegate Hutchinson.
Thank you, Madam Chair. It came out as fast today in subcommittee and just trying to have been processing this, and I just heard something that I need to get a clarification on. So the Department of Health will develop a plan. They would present that plan back to us. But let's say, I'm going to just use an example, reciprocity, because I did have a reciprocity bill in this year, and there was opposed by the Board of Nursing. But the plan comes back and says, we think every occupation should have reciprocity, which actually might be a good thing. We would have to then put a bill in next year for reciprocity for every health occupation. Am I hearing that correct? That like
It will have to come back to us. The plan will have to come back to us, to this body.
Yeah, but but the plan comes back, I think, in October. Is that the date for the plan?
Yes.
And the plan, I'm going to just hypothetically says that we think every health occupation should have reciprocity. but we have to legislate reciprocity. So would we then have to come back next year in session and submit 22 bills for reciprocity across every health occupation, pass that, implement it, or does this supersede our legislative ability to decide whether there can be reciprocity or not in a health occupation?
So the reciprocity agreements aren't legislated because that's like each board looking at the requirements for each license or certification or whatever registration for the health practitioner type that they're regulating. So those are agreements that are done at the board level. You all have authorized it, but those actual agreements are done at the board level. So
I understand, but we have to legislate the right for them to be able to do reciprocity. I mean, why did I have to have a bill in this year even to look into
so they
reciprocity?
already have that. Your bill was specifically directing the Board of Nursing to prioritize that. So you could, hypothetically, you all could come in with a bill, a similar bill requiring the boards to prioritize it or specifically mandating it. This is also quite hypothetical, but to the extent that the boards have to look at what the requirements are to ensure that those requirements are equivalent to the licensing or certification requirements you have in Maryland, you probably wouldn't mandate specific reciprocity agreements. But this is very hypothetical, but you could have a bill requiring some level of reciprocity agreements be pursued by the boards.
But it will have to come back to us. Bottom line, they could not do it on their own. It will have to come back to us.
Okay, thank you. So this is where I'm going at that. We're talking about the fact that we have federal workers who are healthcare workers who will lose their job today, potentially, but they couldn't get a job until after next year's session, and any bill we pass goes into. This is not helping an immediate need immediate issue that we have. Nobody would be able to be hired until after next year's session. The governor signs the bill, and the bill goes into become law. Is that correct?
That is true, but we also can come in on day one, put in an emergency bill, right? That will become effective the minute we pass it as well. And then we could have a special session, who knows if we do, where these things can be acted upon as well, right? Anyway. I'm not saying anything, but we're talking a lot on hypotheticals, right? But the bottom line is that it will have to come back to us.
Thank you. Thank you.
All right. Delegate Collison and Delegate Kaiser.
Thank you, Madam Chair.
And Hill.
And my assumption is, we've had the reciprocity discussion, but if there are folks who are members of a compact, because we have a number of health professional compacts in which we're engaged, and if there are folks who are being laid off who are members of the compact or who can become members of a compact because they have a license in a state that is a part of the compact, those positions can be expedited. We wouldn't need to legislate that. That could come back, and I would encourage the boards to be reaching out to any profession where we have a compact to say, there is the potential you could work in Maryland now if you had a license in a state that engaged in that compact.
And the plan can also be an outreach program. It doesn't necessarily mean we're doing anything with a license, right? How can we help these workers? So it's only, they're going to look into it. Okay, Delegate Kaiser.
Thank you, Madam Chair. When Delegate Hutchinson asked his question, I was hearing it as, well, we're not helping these people immediately with this because it would have to be studied and we'd have to come back to it. But if we wait until next year, there still might be some need to study it, and then we'd be even further delayed. So I don't know why studying it is such a bad thing. And you're right, we're not getting to it quickly, but this may help us get to it quicker. So that would be my reaction.
Yeah. Delegate Hill.
Thank you. And I really love this idea. Thank you, Delegate, for moving this amendment. I just want to sort of state to see what my clarity. It's not a reciprocity agreement in the typical sense. We're defining a narrow group of people, not licensed in Maryland, who are licensed in some health occupation somewhere else, who left employment with the federal government after January of this year. And we're asking the department to look to see if there's a way to capture, give a special allowance for, grandfather, or somehow allow them to begin practicing in the state under a special license or something else. Reciprocity is sort of a broad capture. If you're licensed in this state, we have an agreement. And I think what we're asking them to do is to say, each of the boards, are we satisfied with the licensure from certain states or certain places where we can say, we're going to bypass the usual licensure process for you. We're going to give you credit. We're going to do something. And we're asking them to look at, are there ways that you would be comfortable without compromising our standards, giving these people an equal license, a special license, a temporary license, or something? That's what we're asking them to do. Is that right?
That's right.
Right on. Okay, Delegate Riley.
Thank you, Madam Chair. Yeah, I mentioned in subcommittee, I mean, my only issue, I mean, I see where you're going, but the biggest issue that I have with this is just it's changing our process. There's many times during the interim or with other bills, we always hear it in this committee, we can do this without legislation and compromise the way that we currently do things and have full hearings for all of these boards. I mean, it's very possible that, you come back and even before it comes back to us that the Maryland Department of Health does have certain authority to do this on their own. But why can't we just leave it as is and let the public know that we're going to continue to work the way we always work? And when we put something big in like this, they have the opportunity to come down here, testify. The boards have the opportunity. I mean, you're blindsiding all of these boards. They all operate differently. And now we're just throwing this amendment in there at the 9th hour. And I just don't, I think it's just moving outside of what we normally do. And I don't want that appearance, out there for my constituents. And I think we can take care of this with a letter from Madam Chair, from here, Finance together, send a letter to the Maryland Department of Health and actually accomplish exactly what this amendment is doing, but doing it what I feel the proper way. So that was my only issue.
And usually, as you know, because I've done it for many of you, where I send a letter on different issues that you care about, that we didn't get through it with a bill, and I do it often. In this instance, because the health occupation boards are all very different, and because some of them we've been helping them, right, do well, and helping them with a lot of their issues, and because we need consistency, and I know what's going to happen if I did the letter, right? We're not going to get back from everyone, and that is the reality. I've done this for a little bit to know this is the best way to do it, to make sure that every license, every profession at least has an opportunity, right? And I think the way that I would, when I go home, and my federal workers that are in those positions, and they say, well, what did you guys do for us? There's a website to help us or a program here. I can say, well, I know you have that license. We have directed, and directed is the word, the Department of Health to develop a plan to look at all the health occupation boards. And if I'm not mistaken, there's 22 health occupation boards. Am I mistaken? I think it's 22, and someone can correct me if I'm wrong, to look at it and come up with a plan. I could do a letter, but I know because I've been around a little bit what I'm going to get. And I think that this is the best way so that we are consistent and we give it a serious look. Because some boards, and I know that your partner right here to the left will know that even what he was trying to do with one of the board, there was a simple thing. There should have been a simple yes. Took what? How many meetings did it take us and phone calls and emails?
It was five meetings or so.
Yeah. So that is the reason why. And you know that when you guys come to me and you say, can you write a letter? I say yes. And sometimes I'll say, can we just withdraw the bill and write a letter? But in this instance, given the number of boards, it is best to have consistency. And I understand what you're saying, I do.
One more question then. So I didn't hear it during the subcommittee this morning. So does the sponsor of the Senate bill agree with this amendment? Have we talked with him?
Delegate Lopez?
Yeah, I've spoken to him a few times about it. He is continuing to introduce the House bill clean in hopes that we can work this out in conference. He doesn't want to slow things down on his end.
So what will happen is when we come to conference, if he has told her that, that means that we can work it out. Okay? Yeah. Delegate Rosenberg, you have something else to
Yes.
say?
10,000 people are losing their jobs at the Federal Department of Health and Human Services. And what this bill says, this is an extraordinary situation. Through no fault of their own, these people will be jobless, and they want to continue to live and work in our state. And we think this is the most effective way to put this issue before us next year or whenever is appropriate.
And if I may say, a lot of them live in Maryland because we're so close to Washington, D.C. Yeah, and we have NIH and other people. And there are people that are, I got in emails of people that have worked there for 20 years. They have PhDs, masters, highly educated, and are now without work. And they have mortgages and children in school and all of that. This is a small ask, you know? But I do appreciate the discussion. It's an important discussion. And again, given that we brought it in last minute, it is a fair discussion.
Other questions. So as we're talking, I did this on another bill and we couldn't do it for,
Yeah.
I forget what the reason was. But if this
Can
is
we
this,
listen for a minute? Thank
if this
you.
is this important, can we make this one an emergency bill? Otherwise, we're waiting until like another year, as my good delegate Kaiser had said. So why not amend it to make an emergency bill and make them work on it a little bit quicker? They have a lot of boards and things they've got to get information from. So the sooner the better.
So the report is due October 1st. They know it's coming already, and they're going to start working on it right away. Yeah. Yeah, it's because it takes effect July 1st, so they know it. Yeah. Yeah. No, they know it's coming. Yeah. This is one thing about this committee that I thank all of you, is that you're great communicators. And you communicate, and I think sometimes we over-communicate with some people. And well, I'm gonna stay quiet. Delegate Hill, that's, okay. Okay, we're done? Huh?
To just, again, sort of connect some of the dots. Delegate Hutchinson was talking about the bill he had to do. And, council had said that we had given a year ago all the boards the ability to work on reciprocity agreements. The reason he had to put a bill in is he was saying, you have the ability, we need this to be a priority. A letter says, I want you to make it a priority, but it doesn't make them make it a priority. This bill says this should be your priority, and we need to know by the fall what you suggest we do. And I think that it's important that we understand why this particular method, I don't know if that helps.
Okay. All right. Where were we on the bill? The bill hasn't moved in second. Any further questions or discussion?
Wait, did we move the amendment? You need to move the amendment.
All right, the amendments have been moved and second. Any questions or concerns? Thank you, Delegate Alston. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition on the amendments? On the bill as amended? Opposition to the amendment?
To the amendment.
Okay, Delegate Alston is opposed to the amendment. And Delegate Kerr, okay. Now, on the bill as amended, is there a motion? Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition on the bill as amended? All right. You opposing the bill? Delegate Golston? Okay. Delegate Golston? Okay. Delegate Alston? Okay. All right, so let's move on to the last bill. Senate Bill 981, Senator Hershey. Hospitals.
Well, two of us down at this end, we would like to oppose the amendment and then
You're the
before the bill.
All right, so
That's fine.
let me just, 1 second, for cleanup, just give me a minute, we're almost done. Senate Bill 749. Who opposes the amendment? Raise your hand. Delegate Alston, Delegate Riley, Delegate Hutchinson, and Delegate Kerr. Okay. Anyone opposes the bill? Delegate Alston. All right. Okay. Senate Bill 981, last bill, guys, we're almost there. Hospitals Financial Assistance and Collection of Debt Policy, Senator Hershey, favorable. Aaron.
It's identical to its cross-file. Delegate Goodwin.
It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. We are done, but can you stay on for a second so Michelle can tell you when these bills will be ready and when the bills from yesterday will be ready for you to pick up the folder because you have to defend it on the floor. Has everyone picked up their folders? Excuse me? Oh, they were delivered to your seat. Okay. All right. And then
Madam Chair, I couldn't hear what you said.
1 second, guys. Michelle. So the bills that are for tomorrow, because tomorrow we have bills on the floor, you guys have it right now on your desk. Yes. The bills that we voted today, Michelle will make sure you get it. Okay, because the reason why we can't tell you is because there's so many that we have to look and see, and we're gonna miss someone, okay? So just be patient with us. And please be ready because we have 11 days and this is when questions come up. I need you to pay attention when your bill is coming up. Make sure you have the folder. Do not leave it in your office. And when you're done, after second reader, bring the folder back to the office. After third reader, sorry, bring it back to the office. But please be ready, okay? Yes, Delegate Chisholm.
One quick thing, I do have a concern. I'm deeply concerned that when my seatmate becomes a senator, we're going to be completely out of animals. So maybe we should stop passing animal bills for the current senator.
Because we had so many animal bills today. Okay. So I just want to say thank you to staff. I know you're doing a lot of work. This is last minute. Thank you for keeping us straight. Guys, even though we have had these bills before, do not be overconfident. Please call the LAs. You have their numbers, right? And I know you can do it. I know you guys can